So, we're ready to start a secondary IV line. So I have my supplies here. I have my piggyback, which is my secondary fluid here. We'll pretend it's Rocephin, an antibiotic. We have our fluid that we're using to pass the medication through. It's just dextrose. We verify that this is compatible with our antibiotic. Okay, and so for testing purposes, I'm going to go by the script here. So first thing we do is we verify the physician's order. We collect our supplies, set it up, priming the tubing to, and correct me if I'm going out of steps, because I'm just kind of going off the top of my head. First thing we want to do is prime the primary line, which would encompass getting this whole line free of any bubbles. And then next thing we do is spike this guy, and we connect it here after using sterile technique with the alcohol swab for 10 seconds, and then we back flush by having this one lower than the primary. So now that this is all set up, we'll leave it at the I'll bring it into the patient's room. So I go to see the patient, I identify her with her wristband, I look for the medical record number and name, and once I've verified the patient, I'm going to go ahead and flush her IV line. So I have pretend I have an alcohol wipe because we're low, and I put my gloves on. Am I still on the steps? Yeah. A few things we check too with the fluids is that they're clear. There's no leaks in the bags. Expiration date, of course, is it hasn't expired.
And you explain the treatment, which pertains to the body.
So now, So now that I'm with the patient, I'm gonna tell her why she's getting this fluid. So, Miss Patricianato, we're giving you this. Did I say it right? Wait, this is not comedy. We'll go straight. We're giving you this antibiotic to help with your infection of pneumonia. Okay? Okay, so I have my alcohol swab. I'm wiping her IV port for 10 seconds vigorously. And have my primed saline lock. So I've unclamped anything, and I've kept sterile technique. I've connected this, and I'm going to put in 2 mLs to flush the port and check for patency. So now that it's good, I'm going to hang my bag and set this up and connect her. So, oops, my label just fell off. What am I missing, Kreia? Keep the audio going here. Let's talk a little.
All right, you're on the right track.
I'm on the right track. I like that. I like how that sounds. Okay, probably don't want to. The whole time we want to make sure this keeps sterile. You know, don't want to touch it on your clothes or let it hit the floor or anything like that.
What?
What's the infusion?
Here's a bunch of students right here. Did you ask any of these things?
Okay.
I think you must ask Trevor.
I did.
3 o'clock.
3 o'clock. That's right.
Okay, we're gonna be up there at the portable.
Portable, yeah.
Okay.
Thank you.
Unfortunately, I already.
What are you
wrote that.
looking for? People that are computer savvy?
Okay, so I've hung my IV and I've correctly put it into the unit, and now I'm ready to set my rate. So would someone like to tell me what the rate is? What am I doing?
No, 50. Let's pretend it's 50.
100 on your 100 on your
Okay,
primary and
primary.
150 on your secondary.
It's only
Okay,
15
so she has a continuous fluid administration of 100 mLs an hour,
Pretty low.
and we're gonna do about 950, so it cues us in when this is almost empty. And for our piggyback, we're gonna do 150, and we're gonna go ahead and make it the correct amount of volume here, which is 50. If I had a intermittent, I would bump this up to 80, so I would correctly administer all the medication, because the line here, the whole line basically has 30 mLs of fluid, and we want to give that all to the patient for medication.
I thought the secondary is going to be 80.
The secondary would be
Would
80 if it was an intermittent, right? Am I wrong?
No, it's continuous. This
This would be 80 for continuous. Because the correct rate. We want to get, okay, so that was wrong. This is, we're going to make this 80 so that we administer this at the correct rate. And because of that, I might turn this down a little so that I have proper time to change the bag when it's getting empty. Okay, anything I missed? Questions, comments, concerns? Please don't put this on YouTube.
no.
All I know is that if you put intermittent, it should be like we put 30 on top.
If it's intermittent, the 30 is on top, but if it's
Yeah.
continuous, the 30 is on the bottom.
Thirty is in the bottom.
That's
So
why we
what are
put
you
80
doing?
in the bottom.
And okay, I see. And the reason is to
'Cause it's
give it
pulling
at
the
the
30
correct
from the
rate.
primary.
But you should bring back your primary to 950.
Yeah.
Why is that? Because the primary, the
It doesn't
line
matter
It
what
is.
doesn't matter. Yeah, it doesn't matter.
It doesn't
Yeah,
matter.
True.
It's
So,
just giving you
'cause-
extra time.
Okay, cool.
Yeah.
Gotcha.
Okay, so we